How should you write notes in nursing school to ace your exams and reduce your study time? Well, in this video, we're going to exactly show you how to do it. Hey guys, my name is Will Kirkpatrick. I'm a nursing educator inside the Coursera platform. Before we get right into it, I want you guys to please remember we have a free download of a pathophysiology concept map, which will go directly along with this video. So make sure you guys download that and the link in the description below. So in this video, we're going to show you how to specifically take notes, but there's other videos where we show you how you should study in nursing school, and we study by 5 segments in our Coursera platform. So every student that comes on our platform, we pretty much reteach them how they should study, and it helps them improve their exam scores. So we study by 5 segments. Note taking, which is what we're doing today, note reviewing, practice questions, active recall, and then practice exams. If you guys want more details on how you should study, then make sure you guys click the link in the top corner right here. All right, so let's get right into it. So how should you take notes in nursing school? So it depends on which class you're actually in, but the first point is here that you should standardize your notes. What does standardizing your notes even mean, and what does it do? Well, when you standardize your notes, that means you have a complete template of how you take notes throughout the entire program. Well, what does that do? Well, first, number one, it helps you organize your mind and organize how you put your mind onto a piece of paper, basically. So it helps retain the information and apply the information, which you know is very important in nursing school. So for example, the med-surg classes, that's why we mentioned the pathophysiology concept map, because this concept map is a huge study hack or a huge note-taking hack for nursing school, because it helps condense all the information you need to know into one page. It's very easy to read, and it's easy to understand to apply that knowledge. But many struggle with not just note-taking, but they struggle with what they should even take notes on. So, of course, as you know, nursing schools, they like to give you like 20 chapters in 1 week to read, and then you have your exam next week. There's really not a whole lot of time, so it's pretty much impossible to read word for word in your nursing textbooks, and we actually don't recommend that you do, because you're really just wasting time, and you're not going to be able to retain all that information. So how do you actually condense the information down? Well, what we tell our students is, number one, instead of reading through the book and like actually reading everything word for word, you want to be a master at skimming. So what is actually skimming and how you actually do it well? So every chapter, guys, has a list of objectives. And if your chapters on your book for some reason don't have a list of objectives, your nursing program syllabus will. So every chapter they assign, they'll have objectives for that exam that you need to understand. So print that list out, and then you want to answer those objectives with the content in your textbook. So if there's an objective of learning and understanding nursing diagnosis and nursing interventions for heart failure, I'll be going through the book and I'll find exactly where it is under heart failure, the nursing diagnosis and nursing interventions. I'll take that information and put it right where the objective is, so that way I know what I should be looking at with all this content being thrown at me. I'm telling you guys, that is a huge hack. Instead of reading everything word for word, focus on the objectives and find the information from your textbook that is applying to that objective. So once you do that, now it's time to standardize your notes. So you have what you need to know, and now you need to standardize how you retain that information. So a popular way is doing a concept map. Specifically, since med-surg is so heavy in pathophysiology, we're going to use a pathophysiology concept map in this example. And once again, guys, it's a free download on our website, tactilevr.com, or click on the link in the description below. Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. So let's show you how you exactly write down notes in a pathophysiology concept map, and you'll see why it's so effective. So in a pathophysiology concept map, you'll see here, it's categorized in multiple different sections that helps you easily digest the information you need to know. So with every disease, it's free game on your nursing exams. You're going to need to know different things about the diseases and what a nurse should do and look out for with every one of them. So this pathophysiology concept map, make sure you understand everything that's included in a disease and helps you connect the dots. So in a pathophysiology concept map, you'll see there's a section for signs and symptoms, risk factors, complications, pathophysiology, medications, labs, medical interventions, nursing diagnosis, and nursing interventions. So we're going to fill out this pathophysiology concept map together by putting in information from heart failure. So let's first start with pathophysiology, because that is the foundation of understanding every disease. So pathophysiology heart failure, as you see, let's just plug in that information there. So now we understand, pathophysiology helps us understand what's going on inside the patient's body and why it applies to everything else that we're going to be talking about. So signs and symptoms. Signs and symptoms are typically related to the pathophysiology, so it's going to be able to help you connect the dots there, right? So you understand the pathophysiology, the signs and symptoms relate. So if heart failure specifically, we can write down the difference between right-sided heart failure and left-sided heart failure. Then going on to risk factors and complications, as those are also heavily related to your pathophysiology. Risk factors, we write that down here. And then complications, it shows up in here. So now, as you guys can see here, there's going to be lots of nursing questions that ask about these different categories, right? But if you understand the pathophysiology, it allows you to concept those other factors, and it really makes sense to you when you apply that information. So then we're going to go over to the section of labs and diagnostic studies. So we're going to fill that information out here because, of course, there's lots of nursing questions about that as well, because nurses need to know how to monitor their patient. So with heart failure, we should know that the BNP is a very big factor in understanding the status of heart failure. So the higher the BNP level, the higher amount of fluid retention essentially there is. And then also an echocardiogram is typically used to see if there's heart failure, especially systolic heart failure, and that we know that an ejection fraction below 40% is considered heart failure. So that was another way we can concept that information out. And then going on to medical interventions. So this is like your medications or any other medical interventions such as diet or activity. So we are able to apply it here in that section. And then nursing diagnosis and nursing interventions. Of course, there's going to be lots of questions about that. And the nursing diagnosis kind of helps you understand where you should be looking for these types of patients. And then also nursing interventions, of course, these specific bedside procedures that you'll do as nurses. So as you guys can see here, the concept map allows you to apply all that information. So whatever they throw at you in your nursing exams, you have it condensed right here for that specific disease. So that right there, guys, is most definitely the best way you should write your notes. Now, there's, of course, other ways to write notes. I'm not saying there's not, but the pathophysiology concept map should be your foundation because a lot of your classes are going to be very patho-heavy, and you need to understand that because a lot of your nursing scenario questions are going to fall back on those concepts. Now, when I was in nursing school, I'm a very visual learner, so make sure you double down on your learning style. We have, once again, those study hacks that you guys need to go watch because it really reflects on note-taking as well, and it will significantly improve your exam scores if you take the time to learn these study tips. So make sure you guys watch that video. But I want you guys to know that note-taking is just one segment of studying. Of course, after you're done note-taking, you do your note reviewing, but here's the kicker. After you understand a concept, I want you to immediately apply that knowledge with nursing practice questions, okay? So as soon as you learn something, say if I just now learned the difference between left-sided heart failure and right-sided heart failure, I want to challenge myself with nursing scenario practice questions that challenge my understanding on that signs and symptoms. So if you do that, you're not only going to be better at learning the information, but you're also going to be way better at applying the information. And then there's something called active recall. So this is different than practice questions. So active recall, you either use a flashcard or a whiteboard, and you're just using your mind. You're not having multiple choice questions. So basically active recall is when I ask myself, okay, what's the difference between left-sided heart failure and right-sided heart failure? So then I'm going to write down the differences on a whiteboard or on a flashcard. So that way I'm really refreshing my mind to think independently, and that really improves your ability to apply information. And then the last step, of course, is practice exams. So every time you have an exam coming up, I want you to take 2 to 3 exams that are going to be exactly like your exam coming up. So if your exam is over 50 questions over cardiac system, I want you to take 2 to 3 50-question practice exams, just like how you would take it on the exam day. All right, guys, that sums up everything with note-taking. Now, I highly recommend you guys go watch our study hacks video, as that's going to give you more information on how you should be successful in nursing school. Thank you guys for watching, and I'll see you guys in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.